You may have heard someone tell you that Canadian healthcare is free. That sounds great, so why not pack your bags and move to Canada? The truth is, just because something might seem like it's free doesn't mean there aren't hidden costs to it. For starters, there are a lot of medical treatments that are not free in Canada, and more so, there are many lesser known costs to Canadian healthcare that usually aren't acknowledged. Let's take a deeper investigation into those hidden costs. To begin, let's address what free Canadian healthcare is exactly. The healthcare system in Canada is also known as Canadian Medicare. It is publicly funded and universally provided to all citizens and permanent residents. This means that visits to the hospital and doctors are free for medically required reasons. But it's important to note that not all services are covered. Some services, like dental care and prescription drugs, require the patient to pay. However, more than half of Canadians have private insurance, which can reduce the cost of these non-funded services. Specific groups such as seniors and children also receive special funding for their healthcare needs. So how does free healthcare in Canada work? Well, each province and territory has its own unique healthcare plan, but they all receive funding from the federal government, which is calculated based on the specific needs of each population. The main source of funding for healthcare in each province and territory comes from tax collection within that specific region. With the goal of providing quality care to all citizens, the Canadian government established the Canada Health Act in 1984. This act standardized free healthcare services, including hospital, diagnostic, and doctor services, and established Health Canada as the national regulatory body for monitoring healthcare in the country. So what is covered under Canadian Medicare? Well, it varies within each province and territory, but it typically covers physician visits, emergency medical treatment, surgery, prescription drugs within hospitals, immunizations, and childbirth. However, services like dental care, vision care, long-term care, out-of-country medical care, and physiotherapy are not covered and may require private insurance. Let's now take a close look at the results of a recent survey conducted by the Montreal Economic Institute in 2021 that uncovered the truth about what Canadians really think about their healthcare system. According to this survey, 66% of respondents said that they were happy with the healthcare system in their province or territory. However, despite their high level of satisfaction, 71% of these Canadians believed that the system was insufficient for meeting their requirements. This disparity between satisfaction and perceived need highlights the importance of continuing to assess and improve the healthcare system in Canada. Now that we've addressed what Canadian healthcare is, let's dive into what the hidden costs are. To begin, let's hear the opinions of real Canadians.
The biggest cost of the healthcare system is the transportation. Like some people, they do live far away from the cities, like they live in the farms, so they have to pay lots of expense for the transportation.
To me, the most challenging and most stressful thing about healthcare is the long wait times. It might seem like it doesn't do much, but waiting for months can become a very stressful thing to me and my family.
The biggest barrier which I think is for me is that I have to travel a lot to my workplace. I'm living in Brampton and I have to travel all the way to Mississauga to my workplace, and I don't even have a car, so I have to take a bus, and it usually takes me an hour and a half and sometimes 2 hours also.
My biggest barrier to healthcare is the fact that I work a 9 to 5, so I can't really make time in my day to go to the doctor. I would have to miss out on work in order to go to the doctor.
Now that we've heard from real Canadians, it's time to question how big of a problem these barriers are. Rural Canadian residents are often paying massive expenses out of pocket per medical condition when seeking healthcare services. For instance, on average, rural Canadians of British Columbia were paying over $2,000 out of pocket when traveling to seek healthcare. Residents were responsible for vehicle transport to medical providers, as well as their own lodging and accommodations. Although this number seems high, transportation costs for Canadian residents in northern provinces is much more. In the Northwest Territories, transportation costs account for up to 5% of total medical expenses per person, and up to 20% of medical costs in Nunavut. 1 in 5 Canadians lives in a rural community, yet only 8% of physicians practicing within Canada reside in these regions. For these rural and northern communities, the cost of traveling for healthcare is huge. These communities must also rely on personal vehicles for travel, as public transportation is typically limited. However, urban residents also incur a large hidden cost for healthcare if they're transported by an ambulance. The average cost of ambulance travel can range from $175 to $500, depending on your resident status. Oftentimes, these costs are not well communicated to patients and become huge barriers in accessing healthcare. Have you ever thought about other barriers to accessing healthcare, such as time loss? A 2017 study in Ontario found that about 70% of Canadians had reportedly missed doctor's appointments due to the inability to take time off from work or due to long wait times. Nearly 37% of Canadians have also skipped doctor's appointments when sick due to long wait times and the inability to get a timely appointment. In fact, half of the Ontario population was interested in online appointments due to the time-related barriers with accessing health services. Canadians are unable to afford the lost hours, wages, and stress on their families due to the doctor's appointments, especially with the new one issue per visit rule. The future of healthcare may be to increase technological-based management and to improve access to healthcare by focusing on the hidden costs more, such as transportation and time costs from long wait times and lost wages. While there are many concerns regarding the costs of healthcare in Canada, the provincial and Canadian government have implemented many interventions to aid the affected Canadian populations. For transport services, the federal government launched the Rural Transit Solutions Fund in 2021. With $250 million over 5 years, the government aims to support the development of transit solutions like more public transit and volunteer community carpooling in rural and Indigenous communities for better access to work, school, and appointments. In addition, First Nations Health Authority is an organization working with First Nations in rural and remote areas, offering medical transportation benefits, meals with some costs, accommodation, and transportation costs when traveling to medical appointments. Additionally, as of January 1, 2023, the Ontario Ministry of Health allows pharmacists to prescribe medication for 13 common conditions to decrease the long wait times in healthcare facilities. This is a beneficial alternative that other Canadian provinces can also implement to reduce long wait times for medical treatment. In terms of taking days off from work, the government does hope to implement a feasible solution that will be practical for both employers and employees in the future. Recently, there has been a proposed solution of virtual appointments instead of seeing a doctor in real time, making it convenient for the patient in many ways. As mentioned before, since half of Ontario residents are interested in virtual appointments with licensed Ontario doctors, this will help reduce long wait times as well as having to take days off from work to see the doctor. Some family practices also give the option of phone call appointments if possible, especially after COVID implementations. Overall, there are many hidden costs to Canadian healthcare, but the government is trying to aid in preventing these. However, this is still the beginning and more action is required. So what does this all say? Does Canada really have a free healthcare system?